Dr. John Torres here with NBC News on this Facebook Live, where I tell you about 3 different headlines that have occurred over the last couple of days. Get behind those headlines a little in depth to give you a better understanding of what exactly they mean, and particularly what they mean for you and your family and your loved ones, how it can help you get through this pandemic and hopefully help you help the rest of us get this pandemic over with sooner rather than later. And then I answer viewer questions. So if you have any questions, please send them my way because I love to answer the questions. They're fantastic. But first, let me start with the headlines. First and foremost, the vaccine. That's the one that's on a lot of people's mind right now. It's a big talker. And a couple reasons. One, because we're looking at the vaccine as to when it's possibly going to be coming out. If you remember back in February, experts were saying, look at 12 to 18 months to get the vaccine out. 12 to 18 months would be February of this coming year, or maybe even in the summertime. And that's what it looks like is going to happen. That we're probably going to be getting it to people around that time frame. The reason I'm saying this is because a lot of experts, including Dr. Fauci, are saying now it looks like in December we'll get an idea of vaccines and we'll find the ones that are safe and effective, at least the initial ones. And what he actually said was, and I'll quote him, "We will know whether a vaccine is safe and effective by the end of November, the beginning of December." So, that having been said, let me give you an update of what's going on with vaccines right now as far as what people are calling the race for the vaccine, but it's actually the vaccine development that's occurring around the world. There are around 200 different vaccines that are being developed around the world. China's doing some, Russia's doing some, Brazil's doing some. There's different vaccines being developed. Some are in further stages along than others. Right now, looking at the New York Times Vaccine Tracker, which is the one that I like to use, is very accurate. In phase 1, there are 34 vaccines in phase 1. There are 14 vaccines in phase 2. So that's 48 vaccines right there. There are phase 1 and phase 2. In phase 3, we have 11 vaccines. So now we're talking 59 vaccines that are phase 1, phase 2, or phase 3. Those 11 in phase 3 are around the world. There are around 5 here in the U.S. that are in that phase 3 trial, getting towards the end of their phase 3, where they're going to start getting results. And here's the way it works. They give the vaccine to people, they let them go out in their natural environment around their towns, their communities, and then they see between the people they gave the vaccine to and the people they gave a placebo to, which is not the vaccine but a different shot, they actually look at them to see how many people get coronavirus. Then they see, okay, the people that got coronavirus, did most of them, which is what they're hoping, get it? Were they the ones that had a placebo? In other words, did the vaccine protect people from getting coronavirus? They can only do this if there are enough cases of coronavirus in their neighborhood, in their community, in their area. This was a concern about a month and a half ago when cases were coming down, that they didn't think they'd have enough cases to get that much data that quickly. Well, as we all know, cases have skyrocketed over the last few weeks, and so they're starting to see those numbers that they need to see. They don't need to see a huge amount of numbers. They have 30,000 people in these trials. Some trials are 60,000 people. They need to see a few hundred cases of coronavirus crop up, and then they can compare it statistically to the ones that got the vaccine but didn't get coronavirus, or did, to find out if it in fact protected them. And that's where we are right now. And like Dr. Fauci said, we expect to get that information and find out that a vaccine is safe and effective by the end of November, beginning of December. But what that means is that's when we'll find out it's safe and effective. They'll apply for the emergency use authorization through the FDA. The FDA will take some time to get that EUA done. Weeks, maybe a month or two to get it done. So that's pushing us into the January, February timeframe, which is again what was being predicted February earlier this year. And then they have to start getting it to people. There are different phases of how they're going to do that. The National Academy of Medicine, and if you want more information about that, I had a conversation with Dr. Victor Zhao. He is the head of the National Academy of Medicine, and him and I had a doc-to-doc Facebook Live last week that you can still find, that he gave great information about how that's going to happen in phases and what it means going forward. But the issue is they're going to produce it right now. They're starting to produce the vaccine, but they can't produce 330 million doses of the vaccine, which is actually 660 million doses, because some of these vaccines require double dosing, one at day 0, then one at day 21 or 28, and so they'll need double that amount of vaccine. Simply not going to happen that quickly. So people are going to start getting them January, February time frame, the phase 1, which are the frontline healthcare workers, those that are at risk for severe complications, and then it'll slowly filter down to everybody else, the general population, over phase 2 and phase 3 and phase 4. That'll take time. A lot of experts I'm talking to, and this is kind of what I think, by April time frame, people will start getting it in a general population. And hopefully enough people get it to where we can start getting that herd immunity and we can start getting back to at least a near normal type of life. So that is the vaccine itself and where we are with the vaccine. Now, remember, we have been in coronavirus, in this pandemic, since February. And so we're looking at 8+ months here of being in the midst of the virus and the pandemic and shutting things down, everybody being at home, school shutting down, having to do it remotely, kids not being with their friends. The reason I'm bringing this up is because the American Academy of Pediatrics just came out with a guideline, and they're calling it the Interim Guidance on Children's Emotional and Behavioral Health During the COVID-19 Pandemic. And basically what they're saying is, and their fashion of saying it, is that we really need to look at children and make sure they're doing okay for a few reasons. One, we know that children can have emotional and behavioral health issues, and we really have a hard time telling if that is going on if you're not paying attention. So you want to pay attention, and that could certainly be with them for the rest of their life if they start having issues now and the issues aren't looked into or at least talked about. On top of that, children are a great barometer for what's happening in the rest of the family. So if you start seeing children with emotional or behavioral issues, well, it could be that you're having the same type of issues, just don't know it or just don't see it, or other members of the family are, and it certainly could be an indicator that things need to change a little bit in the family. So what's the American Academy of Pediatrics actually saying about what we need to do? Because we know we've all been locked in for months on end. We know we're not getting together with our friends. We know we're doing a lot of things distantly, virtually, which isn't quite the same thing. With children, that affects them even more because children are very social creatures. That's how they learn. That's how they develop. And that's why a lot of experts are saying we really do need to get them into school if we can do it safely, because they need that emotional and social development that school offers them. So here's what the American Academy of Pediatrics is recommending. That caregivers, as in parents or other caregivers, should be encouraged to have open and honest discussions with their children. And when I tell people this, when I tell parents about this, especially if I'm in my clinic, what I'm talking to them about is have these open discussions with them, have these honest discussions with them, but let them drive the discussion. This is not a lecture. This is not you telling them what they need to know. This is you finding out what they know now and what questions they have, because children will surprise you. They know a lot more than you probably think they know because they're picking up on those things from you, from maybe your friends. If you have a Zoom call and you're talking about something, they might be in the same room or in a different room, and they can hear what's going on in that Zoom call. And they can hear the anxiety in you and maybe your coworkers or your friends or some of the things you're talking about. And so they have an understanding. So ask them what they know so far, where they've heard that, what they think about that, and then kind of guide the discussion from that point of view. But again, the main thing you want to do is you want to make sure you listen to them. For older children in particular, adolescents, that social isolation can be overwhelming. So try to find ways around that. Now, for months we've been talking about doing things virtually. Well, there are ways you can do things in real life as well, meaning you can get out as long as you mask and you social distance. There's nothing to say you can't get out into a huge open environment. And it's something as simple as kicking a soccer ball back and forth between friends. They could be 12, 15, 20 feet apart, just kicking that soccer ball back and forth, and they can still talk to each other. They can still see each other. Extremely, extremely important. And then realize too that children, much like we are, I spend a lot more time watching TV now than I ever have, because there's really not a lot else to do. We're in our house. We don't have anywhere else to go, so we watch TV. Children are doing the same thing. So watch what they're watching. And what American Academy of Pediatrics is saying is this does not mean to tell them not to watch TV. This simply means to make sure that what they're watching is appropriate, number one. And if there are questions that come up, watch that with them so you can go ahead and help them with those questions. Now, it's unrealistic to think you can watch everything they're watching. And so the things that you might have questions about, that you think might be a bit questionable, those are the things to watch with them. But other ones that you've vetted yourself, that you've seen these programs, and the programs are okay for the kids understand the program and it's age appropriate, well, they can watch those by themselves. But the other ones, be careful and sit with them, make sure you can interpret from your perspective what is going on in the program and what that means for them and your family and overall for the pandemic itself. And then the other thing they're saying is explore creativity with the children. Now is a great time to say, hey, have you ever wanted to do this one thing? Have you ever wanted to paint? Have you ever wanted to play the guitar? Have you ever wanted to play a piano? What have you wanted to do? And go ahead and do that. An example I can give you is my nephew lives in Texas, decided to take up the guitar. And so he's having a guitar concert for all of us that we're going to zoom in on just to watch him in a week or two, just because that's something he really wants to do. And his mother, my sister, is really encouraging that, which is fantastic. And so again, you're looking at these things and understanding from the child's perspective, whether it's an adolescent, a teen, a preteen, a young child, what's going on with the pandemic, what that means to them, what kind of issues they might be having or concerns. And remember, modeling is a huge thing for them. So model the behavior, model the ways to handle this stress that you want them to use, because that's extremely, extremely important. And then the last thing, speaking of families, is we're coming up into holiday seasons. And one doctor I talked to said, hey, we are coming up actually into what he is calling the 6 weeks of the darkest period of the pandemic. And that means between Thanksgiving and New Year's, that 6-week period is going to be the darkest period of the pandemic, because we started to get it under control a little bit. Now it's back a little bit out of control again, and we're heading into this time period where families get together, which means it's going to start spreading again across the country. So there are ways to be careful. And one thing is to make sure that people, if they do come over, that you make sure that they come over appropriately, they come over safely, or if you're going somewhere else, it's done in a safe fashion. And so Baylor Medicine just came out with this thing. They're calling it the holiday checklist. We're calling it the holiday bubble checklist, because you're expanding your quarantine bubble a little bit. And again, this is out of Baylor Medicine, and it's a checklist. They're saying, go ahead and start now, because as the holidays approach, there's things you can do. And a couple of things they're talking about. Number one, start now today. Get your flu shot. That's important, because we know flu is going to be here. You want to make sure at least that is taken care of. Then hold a family meeting. Maybe appoint what they're calling a family bubble commissioner, somebody who can oversee all the other family members and make sure everybody's following the guidelines. And what you want to do in that family meeting is say, hey, we're having these guidelines. I want to make sure everybody follows these guidelines before you come to our house. Because as much as they're your family, as much as you love them, remember, you can get coronavirus from them as easily as you can get coronavirus from inviting a stranger over. And so you have to be very careful. There's nothing to say your loved ones have any protective effect on protecting you from the coronavirus any more than a stranger would. So you have to be very, very careful with that. Check travel restrictions, both where you're going, where you're coming from, because it's possible that you have travel restrictions where you're coming from. And if I leave, go somewhere else and come back, I might have to quarantine when I come back. Might have to quarantine when I go there. They also might have restrictions on meetings. Like I know here in Colorado, they are now saying no more than 2 families together at the same time. And so you have to be very careful, no more than 10 people. Unless you're in Denver, they've even reduced that down to 5 people together at the same time. So see what's going on in your state, in your local area. Then they have different things to check off a couple weeks before. Possibly self-quarantine if you can. Look at what you're going to do as far as, do you have the equipment you need? 5 to 7 days before, think about getting a test. And then the day of travel, make sure you wear a mask. You bring it with you if you're going on an airplane or public transportation of any type. So again, this holiday checklist is something that a lot of people can use. The best way to get it, you can go to NBCnews.com and simply put in the search there, holiday bubble checklist or holiday checklist. I tried both, and it pulls up the story that has the holiday checklist link in there. And you can go ahead and go to that. For me, this is an ideal situation, because you don't want to be that one family member that other family members are like, oh, geez, this person's making things up. They're just doing this thing. Instead, you have a checklist like this. You can say, hey, I'm not making this up. These scientists have come out with this. These doctors have come out with this. Let's all follow these guidelines. Let's all check these things off. It has a place down here you can have people initial and send back. Might be a bit of an overreach there, but at least have people talk about this discussion and say, here's what we're going to do over the holidays so everybody stays safe. Because again, remember, they're saying this could be the darkest period of the pandemic so far. You just want to be very, very careful. Now, before I get to the questions, again, going over the headlines real quick, the vaccine, Dr. Fauci and others are saying maybe end of November, beginning of December, we're going to start seeing results from the vaccine trials, and we can start looking at the company starting to look for the emergency use authorization. But distribution, of course, is going to be an issue, and we'll keep an eye on that. Children and COVID with mental health and emotional issues, keep a very close eye on them. Remember, they are a barometer for what could be happening in the rest of the family, but we also need to focus on their emotional and behavioral well-being, because what happens now affects them for the rest of their life. And then the holiday bubble checklist that I talked about out of Baylor Medicine. It's a great tool to use to make sure that anybody that's coming over for your holiday celebrations is safe, keeping you safe, keeping your family and your friends safe as well. A very important thing to do over the holidays. Let me see if we have any questions.
Are you comfortable with air travel now? Is it safe to travel?
So am I comfortable with air travel? To a certain extent I am, and here's why. The Department of Defense did a study. It was pretty interesting. They put a bunch of mannequins on the airplane. They actually set the mannequins up so they were breathing, they were coughing. They were doing things that we do that could get respiratory droplets, aerosolized droplets out there, and then they sat them around different parts of the airplane. They put masks on them, see what would happen, and they found out that if every mannequin were wearing masks, so essentially if everybody in the airplane were wearing masks, the chances of getting coronavirus were extremely small. It was less than 1% chance of getting coronavirus. But the caveat there being everybody wearing masks. And that's why you're seeing these mask mandates happen across different airlines, and people actually getting kicked off airlines and putting on no-fly lists because they're not wearing masks, because that not wearing masks could actually cause issues for other people catching coronavirus. Now, the other caveat behind this is when you're on the airplane, things are fairly safe because, to a certain extent, they clean it better than they did before. You still might want to clean your area, but wearing masks, goggles if you think you need them, it can be very helpful. But the thing you have to remember is before you get on the airplane, at the airport, after you get off the airplane, particularly at the airport, you have to be careful there because that's when you start interacting with other people, and they may or may not be wearing masks. You have to be careful, social distance, wash your hands a lot, just keep an eye on things and keep away from people as best you can. So airline travel itself, safe. The airports before and after, not as safe, but there are ways to make it safer, and that's basically you wearing a mask, you social distancing, you washing your hands. If you can get to an area that has windows open or is ventilated, that can help as well.
How long do you think we'll have to live with this virus and wear masks?
So the question is, how long do I think we'll have to live with this virus and wear masks? Well, I think a couple different things. One, live with the virus. This virus is probably going to be with us for the rest of my life. It's probably going to be with us for the rest of most of our lives. And if you think about it, look at viruses that we have going on in different areas. Measles, mumps, rubella, all these different viruses, even the plague, they're all out there. And they don't go away, but we find ways to handle them. And the way we typically find ways to handle this is that herd immunity, usually through vaccines. And so once we can get to that herd immunity, then we can go ahead and get this controlled. Not eliminated, but controlled. And the reason I'm saying that is because in the history of mankind, through our vaccination efforts, through our medicine efforts, and it was a very strong effort, there's only been one virus that has been eradicated, and that is smallpox. And it took a whole world effort to get that eradicated for very good reason. Smallpox has a 30% mortality rate. So 30% of people that get it end up dying because of it, and it decimated populations around the world. But to date, that's the only virus we've been successfully able to eradicate, which means we're more than likely not going to eradicate this virus. We're more than likely not going to eliminate it, but we're going to learn how to live with it. And by that, it's similar with the flu. We've learned how to live with the flu. We've learned how to live with measles. We've learned how to live with these other viruses by making sure people stay protected and making sure that the vaccine can help people protect themselves and others from this virus. Now, as far as masks, I think what you're going to see is people are going to start getting this vaccine in phases. The four different phases that the National Academy of Medicine came out with, which means it's going to take a while for more people to get the vaccine. But remember, the vaccine in and of itself is not going to eliminate the virus. It's just one tool to eliminate the virus. So even after the vaccine, I think things are going to open up. We're going to be able to travel more, do more things, have more events together, maybe sporting events, concerts, school, those types of things. But at the same time, might have to wear masks in a lot of those situations, at least for the upcoming year. Historically, pandemics have been about 2-year events. We're hoping to pull that back a little bit to an 18-month to maybe 2-year event because of the tools we have, including the vaccine. But again, the mask will be there for a bit. And my guess is the mask will probably be there. It's going to be a new normal. And so every time these things start happening, maybe in the midst of flu season, coronavirus season, if there is one, we'll be wearing masks just to help mitigate it to a certain extent. But if the mask is what we have, and the mask is the one tool we have, which a lot of experts are saying is one of the best tools we have, to keep us open, to keep things flowing, to keep businesses going, and us being able to do the things we want to do, it's a small thing to wear. It's just a mask.
How long do the virus antibodies last once you've had coronavirus?
So if you had coronavirus, how long do the antibodies last? And the answer is, it's anybody's guess at this point. What we have found out is that, yes, people do develop antibodies after recovering from COVID-19. They develop antibodies a lot of times based on the severity of their symptoms. If they have mild symptoms, then they get a few antibodies, and those antibodies seem to last 3 to 4 months. If they have stronger symptoms, moderate to severe symptoms, they tend to have more antibodies, which tend to last a little bit longer. But what we don't know is, are these antibodies going to last 6 months? Are they going to last a year? Are they going to last a lifetime? We simply don't know. Plus, we don't know what it means to have a certain level of antibodies. What level of antibodies do you need to protect yourself from coronavirus? We simply don't know. And that's why the vaccine is going to be such an effective tool, because it's going to boost those antibodies. It's going to boost your immune system to be able to protect you. Because a couple things go on. One, the antibodies you have, they tend to fade away, but then you can get these, they're called T cells, that help remember your immune system, remember this virus, and can develop the antibodies to attack it very quickly. And so vaccines help develop those T cells, as does COVID-19. Vaccines tend to do it a little more efficiently, a little more effectively. And so that's going to certainly help. But with the actual virus itself, recovering from it, you do get antibodies. We just don't know how long they're going to last or how well they'll protect you from it. And that's why we say, even if you've recovered from COVID-19, even if you've tested for antibodies, you still need to wear a mask. You still need to social distance. You still need to wash your hands. Those things that we know are important to protect you and everybody around you. And don't forget, one of the keys to the masks is that, yeah, it protects you to a limited extent, but it really protects other people around you. And if I'm wearing a mask, you're wearing a mask, then we're both protected as we can be against the coronavirus at this point. Thank you for your questions. They've been fantastic as always. And going over the headlines again, the vaccine right now, there are 11, according to the New York Times vaccine tracker, that are in phase 3 trials. Dr. Fauci and other experts are saying, looks like the end of November, the beginning of December. So we're talking a month from now, month and a half from now, we'll start seeing results of these trials, and they'll probably start looking for the emergency use authorization, which means we'll probably start getting it to people come the beginning of the year, maybe into January, February timeframe, and then we'll get it according to the phases they have come out with for distribution. But distribution is going to be an issue, and so we'll be talking about that as time goes on. But mark my words, distribution will be a problem, because it's 330 million people that you might have to get 2 vaccines into, which is unprecedented to try and get them this quickly, this fast, this robustly, and so it'll be interesting to see. Children and COVID mental health is an issue as well. The American Academy of Pediatrics has come out with some suggestions, mainly, listen to children, realize that they could have emotional and behavioral health issues that they're having right now that should be addressed, and simply talk to them. It's one of the best things you can do. And then holiday bubble checklist. Baylor Medicine came out with a holiday bubble checklist. It's basically one tool you can use to talk to your family and saying, hey, this is not me, these are experts talking, saying this is what we need to do if we want to have a get together, and we want to make sure that we're all safe. Because the important part is to make sure that not just you, but your family, your loved ones are all safe. And on that note, I hope that you, your family, your loved ones, and your community stays as safe as always, and we get through this pandemic sooner rather than later. And I hope for the rest of the week, as best you can, you stay as happy and as healthy as you can.